Hi, my name is Ali Lipsky, and today I'm going to be describing on how all of the different perspectives of telehealth interconnect, and I'm calling this Beyond the Screen. Sorry about it, but I ended up turning the camera off just for this slide because some of the words are being covered with my face. But when it comes to providers and patients, this is genuinely the reason why telehealth even exists. Patients are expected to use telehealth correctly, and the same goes for providers. Providers always need to be responsible and caring if they were in a clinical setting. That's what patients are expecting from the provider, so it needs to happen. And then patients should always have to sign consent so they always can feel comfortable. Dr. Basford, this is a doctor that describes that some of his patients preferred having a telemedicine visit. Being online or on the telephone is more comfortable for them. And then she also added that many people with disabilities have transportation issues as well, and telemedicine can be a solution. So, genuinely, telemedicine is changing the game. I put a little picture of the benefits for patients and providers because I thought it was interesting. For providers, they have increased capacity, confidence, expertise, and professional development. I also want to add that there's a lot of convenience added for both providers and patients. And then another benefit for patients would be increased access to the best practices, collaborative care, convenience, and care coordination. Policies are very important to be followed. Telehealth policies provide a standard, so rules have to be followed. Provider participation in telehealth may increase as policy creates an increased trust in the patient. That's basically just saying that trust in the patient will be like patients will feel trusted if providers make sure that they feel comfortable and follow rules. Some compliance that providers need to follow is HIPAA, keeping their licensure, prescribing medication they need to make sure to follow in their own scope of practice, and then follow Medicare and Medicaid policies and any other policies that telehealth has to offer. I believe it's very understandable for patients to be worried about privacy or discrimination, but I will assure you that the U.S. Department of Health and Human Services states that they have health care provider policies so these things don't happen, and if any non-discriminatory or if any discriminatory things happen or privacy concerns, you can always reach out to the Department of Justice because that's just not right. Without technology, telehealth literally would not exist. Obviously, you need the provider and patient, but you also need a screen to be able to talk to your provider or the patient. And I genuinely believe as technology advances, telehealth will become more and more seamless. So after COVID-19, telehealth plummeted, or didn't plummet, it expedited like crazy. And technology can really enhance usability, it improves security, and offer things like remote monitoring so people don't have to worry about things like that. And then providers and patients need to know how to use technology properly so engagement is the most adequate as it can be. And then with this day and age, most providers and patients should know how to use the services, but there's always usually rules on different apps and platforms like MD Live, which I showed on the picture. And then telehealth truly has advanced so much that apps are just transforming the game. So there's so many apps that people can choose from. I found this little quote from RelyMD when finding the best telehealth vendor. Basically, it just says not all telehealth vendors are created equal, so it's important to look at which one would suit you best so you can use the right provider and get the service that you would want to succeed. The business perspective truly interconnects with telehealth. Creating a successful business is crucial so telehealth companies work and can be sustainable. Some important things to consider when starting a business is marketing, the technical plan, training and testing, operationally planning it, and then evaluations. I put also an example of, for example, when thinking about running a marketing when doing your marketing, it's important to think of the questions of, are there others in your areas providing the similar services for your patients, or do you currently have enough clients that are likely candidates for your telemedicine service? Another thing I added was funding truly influences the sustainability of services and enhances outreach. Funding is so important so telehealth can keep expanding and becoming even more successful. I put a graph of how telehealth has increased from 2010 to 2017. It truly has increased exponentially, and because it's 2024 now, I bet we're seeing a much higher number of hospitals using telehealth, especially because of the pandemic that happened a few years ago. I believe telehealth is the future of healthcare. Accessibility is increased as underserved populations in remote areas can get the care that they need genuinely from the click of a button. Telehealth can lower costs for patients and is truly just convenient. I think convenience is a big thing nowadays, and telehealth is just so easy to use. It's adapting every day, and the flexibility of getting care over the screen is becoming increasingly popular. COVID-19 really just changed the game when it comes to telehealth. And then a quote or a little citation that I put was, consumers are reconsidering how they plan to address mental and physical health challenges, how they think about getting health care, how they will manage their needs, how they expect to do business. Telehealth is just becoming such a big thing that people are using nowadays and will be the future of healthcare. These are my references.